Dear partners, let's talk about BUS stent selection and treatment algorithm. I'll walk you through everything you'll need to understand well, how to choose the right stent in the right time, and the right step throughout patient journey. Let's go. When treating bulbar urethral strictures, correct stent sizing is critical for safety and long-term success. The first step is accurate measurement. Measure two key parameters: the length of the stricture and its distance from the external sphincter. These two values guide stent selection. As shown here, the recommended approach is to select the longest stent that fully covers the stricture, while respecting sphincter safety margins. Remember that the longer the stent is, the less migration you will have. The stent should extend at least 1.5 centimeters beyond both ends of the stricture, but must not cross into the external sphincter. The sizing table helps translate measurements into the correct BUS length, 50, 60, or 80 millimeter depending on anatomy. Again, when you can, use the longest stent possible. Normal BUS stent has a smaller diameter in its proximal end to make it fit for the sphincter. The BUS reverse is flipped and has a wider diameter in its proximal end. You use the normal stent in cases where the stricture is up to 2 centimeters from sphincter. In strictures located more than 2 centimeters, use the BUS reverse to avoid urine outflow in the smaller diameter end of the normal stent. The three images on the left show normal BUS positioning up to 2 centimeters distance between sphincter and stricture, and the two stents on the right are more than 2 centimeters, therefore BUS reverse. Proper sizing ensures full coverage, minimizes migration, preserves continence, and optimizes outcomes with the Allium bulbar urethral stent. This treatment algorithm highlights the role of the Allium BUS as a reversible, minimally invasive treatment, positioned between repeated endoscopic procedures and irreversible surgery while keeping all future options open. Initial treatment typically begins with dilatation or urethrotomy. In selected cases, implantation of the Allium bulbar urethral stent, or BUS, can already be considered at this stage. When strictures recur after urethrotomy, BUS implantation becomes a recommended minimally invasive option, offering prolonged patency of up to 3 years and in 80% of benign cases, according to Allium studies, even a permanent cure after around 1 year, which releases patient from further interventions. Surgical options always remain available. They have high success rates but are very complicated with hours of operation, require experience, demand long recovery, and complications can be severe. After recurrence of strictures post-urethroplasty, you can also use Allium BUS. BUS stent shows best effectiveness after first and second DVIU with around 91.5% success, falls to 80% after 3 interventions, and after the 4th intervention, BUS success drops to 66%. So the sooner to use Allium BUS, the better. This is 3 minutes on BUS stent selection and treatment algorithm. Pay attention to details and you'll nail it. Thanks for watching.